Healthcare is the one thing people assume will work when they need it, right up until the moment it doesn't. That assumption becomes especially dangerous when someone transitions into Medicare, because Medicare does not operate like the healthcare system people think they're entering. For Americans approaching 65, Medicare feels like a single program that simply replaces employer insurance. That belief is exactly where confusion, stress, and long-term financial exposure begin. Medicare Clear Path exists to replace that assumption with structure, because Medicare was never designed to be understood as one system. Here is the part that is rarely explained clearly. Medicare is not one system. It is a collection of separate systems layered together. Hospital coverage follows one set of rules. Outpatient and physician care follow another. Prescription coverage operates under an entirely different framework. Supplemental coverage and private alternatives add additional layers, each with their own timing, costs, and consequences. These systems do not automatically coordinate with one another. A decision that works perfectly in one area can quietly create a gap somewhere else without warning. That is why people say they did everything right and still feel blindsided months or years later. They didn't make a bad decision. They made a decision without seeing the entire structure. This fragmentation is buried in complexity that most people never see up front. It only reveals itself later through higher costs, denied coverage, or rules no one explained at the beginning. Medicare Clear Path exists because clarity has to come before commitment, not after consequences appear. In the next video, I'm going to uncover why Medicare deadlines don't line up with each other and how that mismatch silently traps people who believe they followed every rule. Watch the next video.